Hello students, good morning. Today we are discussing about axial skeleton. Axial skeleton हमने कल पढ़ा था कि क्या होता है. आज हम इसके बारे में पूरा डीपली पढ़ने वाले हैं. A part is that cranium. It is formed by flat and irregular bones that provides a body protection to the brain. First one is that frontal bone. It from the forehead. It forms part of eye sockets. The coronal sutures joins the frontal and parietal bones. Parietal bones. It forms the sides and roof of the cranial cavity. It articulates with each other at the sagittal suture. It joins the frontal bone with coronal sutures and optical bones with lambdoidal sutures and the temporal bone at the squamous sutures. Second, temporal bones. These bones lies on each side of the head and form immovable joints with the parietal, occipital, sphenoid and zygomatic bones. The temporal bones articulates with the mandible at the temporomandibular joints. First, occipital bones. It forms back of head and most of the base of the skull. Skull is means head. It has immovable joints with the parietal, temporal and sphenoid bones. Sphenoid bones. It occupies the middle portion of the base of skull and it articulates with the occipital, temporal, parietal and frontal bones. Ethmoid bones. It occupies the entire part of base of the skull and help to form the orbital cavity, the nasal septum and the lateral walls of the nasal cavity. It is very delicate bone containing many air sinus that opens into the nasal cavity. This is a diagram of axial skeleton of the skull. The face, facial bones, nasal bones form the bridge of the nose, maxillae form the upper jawbone from most of the hard palate, separates the nasal cavity from the oral cavity. Zygomatic bone, commonly called cheekbones, from the prominence of the cheeks. Lacrimal bones form a part of medial wall of each orbit. Palatine bones from the posterior portion of the hard palate. Inferior nasal conchae form a part of the inferior lateral wall of the nasal cavity. Vomer form the inferior portion of the nasal sputum. Mandible, lower jawbone, the largest, strongest facial bone, the only movable skull bone. Second, nasal septum divides the interior of the nasal cavity into right and left side. Broken nose in most cases refer to septal damage rather than the nasal bone themselves. Orbits, eye sockets. Foramina, opening for the blood vessels, nerves or ligament of the skull. This is also the axial skeleton diagram, and this is the mandible, the vertebral column, also called the spine, backbone or spinal column. Functions to protect the spinal cord, support the head, serve as a point of attachment for the ribs, pelvic girdles and muscles. The vertebral column is curved to varying degree in different locations. Curve increase the column strength, help maintain balance in the upright position. Absorb shocks during walking and help protect the vertebra from fracture. This is the again diagram of vertebral column. The vertebral column composed of series of bones called vertebrae. Adult में 26, 7 cervical are in the neck region, 12 thoracic are posture to the thoracic cavity, 5 lumbar support of the lower back, one sarcum consists of 5 fused sarcal vertebrae, one coccyx consists of 4 fused coccygeal vertebrae. Invertebral disc found between the bodies of adjacent vertebrae functions to form strong joints, permits various movements of vertebral column, absorb vertical shock. Vertebral typically consists of a body, weight-bearing, vertebral arch, surround the spinal cord, several processes, points of attachment for muscle. This is the diagram of invertebral disc. This one. The axial skeleton again, thoracic cage. Thoracic cage is formed by sternum, ribs, costal cartilage. Thoracic vertebrae functions to enclose and protect the organ in the thoracic and abdominal cavities, provide support for bones of the upper limbs, play a role in breathing. Sternum, breastbone located in the center of thoracic wall, consists of manubrium body, xiphoid process. Ribs, 12 pair of ribs give structural support to the sides of thoracic cavity. Costal cartilage. Costal cartilage contribute to the elasticity of the thoracic cage. This is the diagram of thorax. Again, this lecture we repeat in again. Thank you.